Welcome to the Medicare Education Expo Policy Context webinar. This webinar covers information on fee-for-service Medicare. We are unable to answer Medicare Advantage plans or Part C information questions. My name is Tom Ryan and I'll be your host today. Today I am joined by a variety of people from my team, so you may hear them speak up. We have people from all kinds of different departments that are joining us just to hear information, but also offer any support that they may have. So you want to make sure that you're aware that it's not just me who may be answering you. My goal today is to meet the needs of everyone asking relevant pre-submitted questions gathered during registration. We had so many questions that we actually will not be able to make it through all the questions today. I just want to make everyone aware of that. What we've done is move some of those questions to the next session, which is a question and answer session. It'll be the final session of the Medicare Education Expo, or session 5. A little bit of housekeeping, of course, that's where we're going to start. One, if you want the material from today, oops, I did not change this. I did send it out to you. Now, I will tell you that we will post this material on the Encore presentations page, which means the Encore will be posted. We are recording it for that purposes, so if you're recording, you don't need to be doing that. And what we're going to do then at that point is post the presentation with it. The presentation, again, was emailed either to you yesterday or about 5 minutes ago. So we will keep the Encore available for 60 to 90 days. I do recommend that you send any questions to the email box, WPS.GHA.education@WPSIC. Please incorporate policy contacts in there somehow. Now, the reason that we're doing that is because I have had so many questions come in that while you can put them in chat, I'm not sure we're going to get to them. So it's better to send it to the email box. You will be asked to take a survey, and I want to remind you that each session in the Medicare Education Expo has its own survey. We're looking at how that particular presentation went along with how WPS does as a whole. So you will be asked again, if you've already attended other sessions, to do another survey based in this presentation, but don't forget to do the ones from the 3 that came before me. A couple of basic disclaimer information. The material that was created was current as of today, but for anyone that is aware of it, I want to make you aware that Medicare rules do change, so anything that changes you'll have to keep up with, and we'll talk about some of those stuff, especially with local coverage determinations and national coverage determinations, which are the 2 types of policies. The answers that I'm going to give you today are based on the facts given in the question. We did have some questions that were very general or generic, so hopefully as I get through those questions, I'm going to answer them fully. You can access the most current rules and regulations on the CMS website. This information is the official information. Our website does offer guidance. Now, guidance is different than the actual official information, which is why local coverage determinations, as well as all the information related to those, and national coverage determinations, as well as all of their information, are available on the CMS website. So what are we here to talk about today? Well, we're going to explore when you should contact WPS policy versus another department. Remember, even though this is labeled who to contact, it's the policy who to contact. So that's important to keep in mind. So what we're going to do is look at the information for NCDs and LCDs. Then we're going to look at the information if you have a claim denial related to an NCD and LCD, and you need a question answered regarding that denial. So there's lots of basic back and forth. Also, if you need a basic policy information, generalized question, who to contact. So if it wasn't really related to an NCD or an LCD and you submitted a question, I'll work it in as best I can, but I can tell you that we probably will not get to those and they may be follow-up emailed to you. So getting started, this section identifies the 2 areas you may need to contact regarding policies. The 2 main areas, or the 2 main items you'll need to be aware of. 1 is CMS and 2 is WPS. Now in this case, WPS is the Medicare Administrative Contractor for Jurisdiction 5, Iowa, Kansas, Missouri, Nebraska, and our providers across the nation, and also Jurisdiction 8, Indiana and Michigan. And that's important to understand because if we don't write an LCD or a local coverage determination, you cannot contact us about it. We won't have information on it, but we'll talk more about that. The other main area is CMS. So let's just basically start off with when you'll want to contact CMS regarding a policy. So first, if there's a national coverage determination written by CMS, it's going to cover their information. This does not mean that you need to this does not mean that you need to contact CMS regarding a claim that processed under this national coverage determination. That would be WPS. On the other hand, if you're questioning information, evidence, or you'd like them to reconsider the information within the national coverage determination or NCD, then yes, that is a CMS contact. Now, I've given two basic resources. One, the National Coverage Determination Process and Timeline, and we'll talk more about that. And then the National Coverage Determination Manual. Now, the timeline and determination process explains the full process. We will get, again, into that in just a little while. And the manual is a list of all national coverage determinations. I want to remind you that when you're looking at a national coverage determination and you're talking about the coverage indications or limitations, any of that, that is a CMS area to look at, not WPS. One of the questions we did get is which one takes precedence, an NCD or an LCD? And it's always going to be an NCD. These are written by CMS and they do cover across the nation. Now, please remember, there is a couple of other things that will come into effect. And one of them is an LCA, or a local coverage article. This is a coding and billing companion article to tell you what our system wants. So there's a variety of different factors that we're going to talk about, and we will talk a little bit more about LCAs in just a little while. One of the questions I received was specifically on WPS policy, and do they explain why a claim denied based on that policy? And the answer is no. That's customer service. On the other hand, WPS policy does look at anything with a local coverage determination. You could also add in local coverage articles, but we'll talk about those next. A local coverage determination can be for a single or multi-jurisdiction. Now, single jurisdiction would be J5 or J8. Multi-jurisdictions would be all of them incorporated. WPS policies will always cover both J5 and J8. They do contain coverage information. However, the local coverage determinations and the national coverage determinations do not contain coding information, such as procedure and diagnosis codes. And that's done based on CMS's guidance. CMS says, no, we can't do that. On the other, what they want us to do is to have an associated article. So this article can be related to an NCD, an LCD, or can be a standalone article, no policy at all. And the article is the coding and billing information, as well as information regarding something like what the system edits will look like. Do you need to have certain modifiers? So it's not just procedure code and diagnosis code. There's a variety of different factors that go into this. So let's summarize these three again, and then we'll move a little bit more forward. First, there's a National Coverage Determination, or NCD, which is written by CMS and covers anyone processing claims or who is submitting claims in the United States or its territories. There is a local coverage determination that is specific to a certain geographical area across the country. These are referred to by CMS as jurisdictions. Those jurisdictions for WPS are J5, Jurisdiction 5, Iowa, Kansas, Missouri, Nebraska, and our national providers. Also, Jurisdiction 8, Indiana and Michigan. Next, there is what is called a local coverage article, or an LCA, sometimes just simply referred to as an article. These are not policies. They can be related to either an NCD or an LCD, but they can also be standalone articles. These articles contain information about our system and what our system looks at. So we may say, okay, you've got these indications within the policy that says this is covered. Here's the diagnosis code. Oh, by the way, here's the procedure code that goes with that. Here may be some modifier information you need to be aware of. That isn't in the article related to. Okay. And we'll look more of all of these different things in just a little while. One of the questions we specifically got is, when do you contact who at WPS? I liked this one because it really is the real gist of who to contact. First, if you start with WPS, in general, questions go to customer service. In general, this includes claims questions on how we processed. So basically, if it's regarding an NCD or an LCD and it's regarding how we processed a claim, why something happened, what it's editing against, or something isn't making sense, that's customer service. Now, if it's about what is written within the LCD and you're like, why is this coverage indication there? You said you use this literature to develop this, but that's not what we're seeing. It makes sense based on what we're seeing. That would be a policy type question. Okay, so it's going to be a little bit different. And I'll show you where to find these contacts and different things in a little while. Also, if you would like us to consider adding a new LCD, there are certain things that we're looking for, and you can ask us for an informal meeting, which just helps get ready for it, and then you can make sure you have everything to submit. We also would ask that you update LCDs through the LCD reconsideration process if you would like us to look at those. So related to an LCD would always be WPS. It's just, what are you looking for? Who are you looking for? CMS is another one, but I want to remind you that if it's how a claim processed related to an NCD, that's still WPS and that is still customer service. They're your starting point. Okay. So CMS, NCD inquiries. Can you develop a new NCD covering? You have an NCD, but what we're looking for is why you did what you did, why this is covered and this isn't covered. What does this coverage indication mean? Very different, okay, very different. NCD reconsiderations, did you all catch I said NCD? In other words, hey CMS, maybe our technology has changed. Maybe something else has happened, so now we really should be looking at that to see what's going on. So again, NCD reconsiderations for any reason, those have to go to CMS. So when you look at the basic contacts, I want to start there. And we're going to talk more about another contact that'll happen after a claim has denied in just a little while. And one of the things that we need to be aware of is that not everyone can request a reconsideration or a new NCD or LCD. NCDs are going to cover a much broader category, and that's because they have a national basis. On an LCD, it has to be someone who has interest in the states or the geographical area that is covered. So you can't request us to develop an LCD in New York. That's not our primary jurisdiction. We can look at the providers that we have and whether or not it's needed based on the providers that we have in New York, but again, it's not our primary jurisdiction. On the other hand, if you were a provider in Iowa, you definitely could do that. Michigan, you could do that. If you were maybe a contractor or maybe a sales representative, a technology representative, any of those can request them. Again, nationals or locals, depending. One of the ones that gets left off in this case is the beneficiaries residing or receiving care in those states. They have the right to request an LCD or an NCD. Now again, NCD across the board, but LCD, it is about where they live, where they receive the services. Someone did ask, they have someone who's visiting, and I'm not sure what visiting meant, if they were staying with like a child for a month or whatever, and they were, you know, asking if LCD would cover their area. And the answer is no. The LCD process does take time to put into place. So if we don't have an LCD and another contractor does, just because that person's residence that they're staying at, maybe even not their permanent residence, it's not going to carry that LCD to us. Hopefully that makes sense to everyone. It will only cover when they're in their jurisdiction, the provider base. So when we look at those, that's one of the things we're really looking at. Now, the same requesters can also request a new revision or other types of information. You know, sometimes it's just clarification. What's going on? Why did you choose? What did you follow within all of those types of things? Now that's all done through the policy areas, and we'll show you those in just a few minutes. I keep saying just a few minutes, but it's also that time where we're going to leave the slides for a little while. So new NCD is coming from CMS website, and so I don't necessarily just want to go over the information. I'd really like you to go to the website with me, and I'm going to show you how you can request a new NCD. Keep in mind, this is a national coverage determination. CMS does have timeframes, and they do have to use those. So let me verify with Jennifer again that you can see the cms.gov website.
Yes, you can.
Thank you. Medicare is where we're going to start because we're talking about Medicare. Now, under Medicare, you're going to move to the word coverage in the left navigation. This will switch the right side of the screen, and you can see there's a bunch of it out here for you. I like to go to coverage determination process. I just think it's the easiest way to find this. And yes, there are other ways. If you want to look at those, you can. And then how to request an NCD, to me, again, easiest way, come right here. It's on the left side. Okay. Now this will walk you through all of this different pieces of information. I'm not going to walk you through this process because earlier today, we actually did have a couple of different sessions that went with that. But I will strongly encourage you to read through all of the information. One of the things that we were asked is, if this is a formal process, where is it actually outlined? So let me just say there's going to be a little bit of information down here that you can read through, but it seems pretty short. I'm going to tell you, take time to read this Federal Register right here. And you can see mine is a little bit different color than a blue link. It's because I've actually opened it before. But I really do recommend that you take time to read the August 7th, 2013 Register. You can bookmark this should you want to. Because when you read this Federal Register, it will walk you through all of the national coverage determination information. This walks you through pretty much everything about it, and you want to make sure that you're aware of all of the ins and outs because there is a lot of detailed information in here. Okay? Another way to make sure that you get what you need is to request an informal meeting with CMS to help them determine whether or not you have a valid request. Now, that's one type of informal meeting. We also do have an informal meeting, and if you're wondering, I did just move to the next slide. And the informal meeting is designed to simply help you gauge whether or not you have everything. It's not a negotiation. So for the person that asked me, how do I negotiate for a new LCD? We don't do negotiations. What we do is take your information, we determine whether or not it's valid, which is what this informal meeting will help get through. Do I have everything I need? All of that. We then have to look into the research and the data that you have sent us, not links to it, but that you've sent us. So that's part of the process. So I do want to show you where to find this information on informal meetings. Now, again, this is not a required process. For WPS, which is a local coverage determination, you'll move to our website, and that's wpsgha.com. You're going to go to the Topic Center, and you're going to go to Policies. Once you're inside there, I recommend scrolling down and just open the word Meetings. Then you've got informal meetings for local coverage determinations. And if you select that, it will walk you through all the stuff you need to know. Now, remember, this is not a pre-decision. It's not anything like that. It's just to make sure that you get us the information we need so that when you request one, you have everything in place. It's one of the hardest things to happen when we have to turn down a request, but not because we don't agree that there's not a policy, not because the data doesn't show up there's a policy, nothing like that. The reason we're turning it down is because you didn't give us something that we needed, such as the literature. You gave us a bunch of links, which we can't open. So that literature has to be given. And that's where you're going to find all of this different type of information. A great opportunity to meet with one of our CMDs or our policy nurses, and they'll actually walk you through making sure you have everything you need. I'm going to jump back for just a second, but I'm going to stay right here on this website because I also want you to take a look. If you come down and you look under local coverage, you'll see investigations, but then you'll see new local coverage determination requests. If you select that, this will walk you through the process for a new local coverage determination. Okay. Now, unlike CMS, which has their own process, there is a process defined for contractors, and it's defined in the internet-only manuals. So we'll talk more about the program integrity manual and other pieces of information. What's nice is that this change request is what put this process in place, and you can open it and download it and read all about it. But this is something that you just might want to be aware of. Okay. This area says how to submit your request. Now keep in mind, a lot of times we're going to recommend doing that informal request first. And that's just simply because you need to make sure you have everything in place or we automatically will not consider it. So I think this is just a great way to make sure you meet all those different items that you need. It's going to talk about the next step. Now, one of the things that I got a question on is I got a response saying, hey, we got your request, but you never went any further. Okay, so did you wait within the time frame? So we're saying, hey, we got it. Now we have to complete it, whether it's incomplete, what's going on. So yes, you may get a request or a response saying, yes, we got your request, but we're still waiting. We're still trying to determine, and we have a time frame to do that. So I just want to make sure everyone is aware of that. So your initial might just say, hey, we got your request, great, but that's all it's going to say. It's not saying anything more than that. It's the next one that you have to look at, okay? So I just thought that that might be interesting for people to look at if you're developing a new one. Once it's developed, if we go back to the policy section, and I'll show you where to find these draft ones, this is where you can look at draft. And I also want to point out the next link down, which is your reconsideration, and we're going to get to that in just a moment. So draft is what comes next, and this is just a way in which you can check out and find out what's going on with drafts. It lists all the drafts, but I want you to note that the drafts are actually stored in the Medicare coverage database. Okay? They're not stored on our website. They are stored in the Medicare coverage database. Okay. So with that said, once a draft is issued, which is put out in the coverage database, there's a comment period and all of that stuff, and you can work through that. And that's what some of the different meetings and the comments will be. So if you open this back up, you can see here's the area where you can talk about proposed locals drafts, but it's also going to talk about the comments. So the next item, which should be your next slide 16 maybe, is LCD reconsiderations. This I put in very specifically because we said, what are the requirements to submit a policy update request? And I want to talk about this in a couple of different ways when we talk about this. Reconsiderations is one item where you're saying, hey, I need you to do something with the policy. What do I need you to do? Look at the evidence, look at the information, look at something within that policy for a change. The big thing to remember is LCD reconsiderations are not necessarily done for a typo. Hey, this procedure code should have been 99213, and you typed 99132. Well, okay, that might just be a typo. That's the type of thing you can just send to policy comments and say, hey, we think there might be a typo. They'll go ahead and take a look at it and see. Not necessarily a full reconsideration request. Now, a reconsideration request is outlined by CMS, and it impacts the information within it, and it does need to have items. It does need to have literature. It does need to have a reason for it, and it has very specific things that go with it. If you don't have any of this, which can incorporate the benefit category, we will automatically dismiss it, okay? So lots of stuff going on with that. But again, the reconsideration is of an LCD. An NCD would be on the CMS website. So when we come back, we want to make sure you're in the right area and you're looking at the right information. Someone asked for a full list of contacts for policy. Our basic information, I'm sorry, I did not mean to leave this area, was on the policy side, and you can see here's your policy. Okay, but I want you to point this out right here. A general question should be going to customer service. Don't email us with all these things saying, hey, I have a general question. That's not what we do. We do want you to contact customer service, and that's what this then explains. The reconsideration request, drafts, those go to one area. It just depends on what you're looking for. Okay. So let's talk about contact us up here on the top. Now this is where you can find a full list of all the different types of pieces of information. So if we open this up and we're looking for it, what are you looking for? Again, it's broken down, draft LCD, LCD reconsideration requests, and where should you email each one of those? Don't forget customer service written inquiry versus the telephone system. This is the telephone basic system. This is your written inquiry. And the reason that we point those out separately is that a written inquiry has a different time frame for responding. It's actually 45 business days. Obviously, when you call customer service, it is a different time frame, and that's a little bit shorter, like immediately, or if you have to have it tiered up, it can take up to 10 days to get a response. Okay, so customer service written inquiry, etc. Okay. So that's the LCD reconsideration, NCDs, all of those types of things. Let's talk a little bit about the next item, because the next item on your slide deck, and let me just catch my slide deck up. We've talked about informal meetings, new LCD requests, LCD reconsiderations. The next item is the claim appeal. Why is this important when it comes to an LCD or an NCD? First, it's a medical necessity denial, and medical necessity denials allow for claim appeals. If it is not a part of a benefit category, in other words, Medicare never pays for that because the law said no, or something like that. So it's in section 1861 versus section 1862 of the Social Security Act. We can't do an appeal on that. It's not part of the Medicare program, therefore there's no appeal to be done. Now that's not true if it's regarding a claim denial, and that claim denial is for medical necessity. So one thing to note is that you do want to look for an MA01 or an MA02. MA01 means that you do have level 1 appeal rights, and MA02 means you have level 2 appeal rights. Again, it'll keep going. Couple of things. You do need to file an appeal on a claim, but this is not the same as an NCD or an LCD reconsideration. They're different. So if you want us to look at the NCD and the LCD, then you have to make sure that the information is filed under the reconsideration process for that type of policy. If it is not, then you can file it, or then you must also file an appeal on the claim. It takes time to get through those reconsideration processes, and you only have 120 days for that appeal on that claim, so don't miss out. If you have questions regarding very specific information about an unfavorable decision based on an NCD or LCD, that goes to customer service. Start there. Okay. That doesn't mean that you don't want to continue through your appeals process, which can mean filing your second level of appeal, all of that type of thing. So if you disagree with what happened on a claim, then you must file a claim appeal. If you disagree with the policy, then you must file a reconsideration on the policy. And yes, you may have to do both actions. Yes, you may have to do both actions. If you need an explanation of why something denied, which would include the redetermination or reconsideration, all of that, begin with customer service. That is one of the biggest things we had, is where do I start? And it's always going to be the same answer for y'all. Customer service, unless you're looking for a specific policy reconsideration, new policy, any of that, then that would be either CMS or WPS. I was very specifically asked about when during the appeals process a law is looked at versus the policy. So first of all, if an NCD or LCD is approved, we at the first level, which is the redetermination, level 1, the MACs must follow that information. We have to follow the NCDs and LCDs that were approved and active at the time. Same thing for a qualified independent contractor who does the reconsideration or level 2 appeal. Now we hit level 3. This is an administrative law judge. This administrative law judge does a hearing. Their hearing can look at the legality of an LCD. If they find that this LCD is not legal, they can immediately have it dismissed. This is different than an NCD because the administrative law judge is an employee of the Center for Medicare and Medicaid Services. That's why they can dismiss an LCD, but not necessarily an NCD. Okay, so lots of things to go over there. On the other hand, When we go up the chain, if you hit level 5, you'll be in a federal district court. They can overlook or they can consider under the law either NCDs or LCDs and see what is going on with them. So when we talk about a claim appeal, it will always start with level 1, but it may move up to level 5 and they will consider things differently. Someone asked about level 4. This is the Department of Appeals Board. This is under the Department of Health and Human Services, which is above CMS, but below the federal district courts. And the Department of Health and Human Services can look at a policy. They can ask someone to remove it. They can do a variety of different things. So remember, they're above CMS. So they're obviously above the MAC as well. Okay. Hopefully I got through all those questions on the appeals process without going into too much detailed information. All right, so what's next? Next, I'd really like to focus again back on some of those resources and show you a couple of different things you might want to be aware of, especially when you're talking about LCDs, the process, you're talking about who to contact, because some of this is established within these types of resources. So as resources, we are going to move, to websites. The first website we're going to jump back to is the CMS website. Okay, on the CMS website, one of the areas that you should be aware of is the Program Integrity Manual. This is under Medicare, Regulations and Guidance, and Manuals. So again, Medicare, Regulations and Guidance on the left side, and then Manuals. Once Manuals opens, please go to the Internet Only Manuals. Scroll down. Read the title. So you're looking for Program Integrity Manual, which happens to be 100-08. And what we're looking for within there is maybe a manual about local coverage determinations. We do have that if you happen to open that manual up. Chapter 13 talks about the full process. Now remember, a local coverage determination is something that a contractor writes. So this manual tells us as the contractor what we have to do, the information that we need to know, time frames for doing things, all of these different pieces of information. So there is a lot of information within here. And if you haven't taken a look at this, it can be very overwhelming, but it will walk you through the process. That's number one resource. When it comes to the process, remember, questions still go to customer service. Unless it's a request, then those would not go. Other times that you would need to contact WPS policy is when you are or when we have a draft policy out there and you're giving us comments on it. Maybe the literature, maybe you have different literature you'd like us to consider. Maybe the information isn't written in a clear and concise manner. So you have some better language that might be helpful, that you disagree with it, or I guess you even could disagree with it. All of those would be part of that process, and it's part of that draft process right here in the public comment period. So I really think this is a great way to get what you need out of the information. All right, but let's not stop there. Let's go back. When we look at the information that's also available, there's the Medicare National Coverage Determination Manual, and that's 100-03. What this is just all of the different NCDs, all of them. So you can start with part 1, part 2, part 3, part 4, and you can go through all of those. Yes, this is just one way of looking it up. If you were on earlier today, Leanne, one of my coworkers and friends, she walked you through the Medicare coverage database. That's a great tool, which actually contains NCDs, LCDs, comments on the NCDs and LCDs, billing articles, all of that. This does not do that. This just, if you open up any one of these sections, we'll walk you through anything that we have in terms of the manuals, the guidance on that, a variety of different things. So it's going to be a little different, and it's a little different way of looking at items within the National Coverage Determination Manuals. All right. One of the other areas that we just want to show you, because I just mentioned it, so I thought, oh, I better show you since I mentioned it, is the Medicare Coverage Database. So we're going to go Medicare Coverage Database. Now, if you said, I don't want to do all that, I just want to be able to type MCD in the search, great, do it. I'm not going to go through this entire area of how to use this. Again, Leanne just finished up a class on it. So Wes, I just finished up. It was an hour ago. So I'm not going to go ahead and walk you through every single thing that goes in here. We won't get to everything that we need to do. But I do want to remind you that the Medicare coverage database is for local coverage determinations and national coverage determinations. Okay. Everything related to those is in there. Sorry about that. Um, So if you want to take a look at this, you can. Let's just say we're going to pick a state that we have a jurisdiction over. So I'm going to do Iowa just because, and I'm going to say I want surgery information. What will happen is it will break it down and it will tell you, is it an NCD? Is it a national coverage analysis, which is the analysis used to create NCDs, or not create an NCD? Maybe it actually came back and said, nope, no NCD is needed. So that can also be a national coverage analysis. But here you can see we've got that, and then we've got the NCD related to it. If we scroll down just a bit, you've got coding and billing articles. And again, I just use a really general term. So if you're like, wow, that's a lot, it is going to be a lot when you use more generalized terms. One thing I want to point out is there's also drafts out here. Draft comment period does end. This one, for instance, did end in 2024. Right now, due to the changes of administration, some of these are taking longer than normal, which is a year. Other ones we're just kind of holding on to. So if you see something like that, just know that we're still working with it. If you're looking for one that is in effect, you'd look for an L number versus, I'm sorry, I'm going to go up for a second here, versus a DL number. Draft, full policy. Here's the draft, which was this one. Now this is the one that's in effect. Okay. You open it up, it'll tell you, oops, sorry, if you open it up, accept the CPT agreements and all that, but then it'll tell you which contractor you're looking for, who it's applicable to. We're going to scroll down for just a second, and it's going to walk you through all these different items. Again, if you want to learn more about that, go ahead and watch the encore from earlier today. But that doesn't mean that we don't link to the MCD. So I'm going to move to our website, which is actually going to be your next slide. And we're going to talk a little bit about some of the links that you need to be aware of. First, right on the first page, there is a quick lookup tool, and it's called the code lookup tool. If you want to search for an LCD on surgery, you can do that if you spell it correctly. And it'll bring up the different surgery LCDs that we have as a list. It'll also bring up the coding and billing articles. Someone asked very specifically if they could just see a full list of all of them. I'm guessing you mean a full list on our website of all of the LCDs, and the answer is yes, you can do that. But you do have to go to the tools section and then go to all tools, then use the code lookup tool from here. And what that will do when it loads is you can see everything down on the bottom. So a little bit of a different way, just seeing the same thing. These are all of our LCDs. Okay. Again, it's the same search feature. So you could enter surgery up here on the top again, and the search results are going to look the same, right? But I did want to also point out that you have billing article results, which does incorporate these little pieces of information, which are your procedure codes. So that was another question. You don't need to contact customer service to find out if a certain procedure code is covered under an LCD. You should be able to come out, use the code lookup tool, and find that for yourself. You could also use the Medicare coverage database, enter the procedure code, and have it look it up that way. So just a lot with that one going on there. Okay. As a reminder, when you're looking at the different pieces of information on the local coverage determinations, please use our policy section. But don't forget the fast links down here if there's anything that would be helpful to you. Okay, here's the lookup tool again, a variety of pieces. The reason that we recommend going to policies is, again, they have certain things across the top. And if you go to forms, this is your general inquiry form. Now, if you said, I just went to customer service and downloaded the general inquiry form, you could do that as well. I do recommend that this is where you ask your claims questions, any of those types of questions. And the reason that we recommend downloading and using this form is it will walk you through, and the download didn't say from earlier, but it will walk you through all of the required information that you have to have, and you can explain what you're looking for. This can be an claim number. It could be about a patient in particular, or it could be just a general question. What it usually is not is why is a policy decided upon dot 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 dot. That's a policy related question or other type that could be sent to policy comments at wpsic.com, or if it's an NCD, then you'll want to follow the CMS NCD guidelines. Okay. All right, I'm going to go ahead and move back to the PowerPoint. What's going to happen now is, okay, we've looked at the information here. We've looked at these pieces, these pieces. Now we enter into the question and answer section. I will tell you my intention originally was to having you guys submit questions, but I will tell you I had you do pre-submitted questions and there were so many of them. I'm going to get through the pre-submitted questions first. If there's time, then we'll see what we have in the question and answers in the chat, but I don't really think there's going to be a lot of time. So the first question was, they're confused over how to handle questions on policies regarding NCDs. Again, as I stated, this is regarding what type of question. If it is a claim related question, why did this claim deny? How did you process this claim based on, and insert the NCD? Those are our customer service departments. If they are not, and you are looking for a reconsideration or something related to the actual information within it, such as the medical necessity, then you need to come out and you need to go back. Oop, I forgot we were in that database there. You need to go back to the CMS website and you need to go to the area for NCDs. So you can do it the way I showed you. You could also just type NCD at the top. And not how to request, but here's the basic timelines, and it'll say here's how to request, here's the information you need to know, questions like that. Gives you a full technology assessment, all of those different types of things. Okay, so it really depends on what portion you're after, because each one has its own kind of information that you'll need to know of. I'm just going to go back to the home page. The reason that it's hard is, what if you're talking about a certain type or a certain research or a certain literature? What if you're talking about something different? Those types of questions are all handled a little differently. So again, that's under coding and billing, Medicare, coding and billing. Okay, and Medicare coverage would be the other one that we looked at. And this just walks through the different information that you need to know. Here's another contact information for the some information you might need. Now, please remember that a patient should be referred to 1-800-Medicare. Who do I contact when I have information regarding a denial for an NCD or LCD? So are you regarding the actual NCD or NLCD, or are you talking about a claim denial? And I wasn't really sure. A claim denial is WPS customer service for our jurisdictions, but the actual denial of an NCD and LCD would be whoever denied it in that governing entity. So it could be CMS, or it could be WPS, or it could be a different contractor. If there's an audit or an edit denial, this indicates that it's a claim denial. We always recommend customer service. Now, when I say customer service, doesn't mean you have to do it in the phone. No, you could do it in writing. That's perfectly fine as well. So if you said, hey, I wrote in, or hey, I used the secure net access portal and I did a secure message within that, all of those are fine. What is it that I write in to get a better answer? I don't really know what you're looking for with this one, but in general, make sure that you know what you're looking for. So if you're saying, hey, I want a time frame, or I want something like that, that's what you're looking for. I want a claim denial explanation. I know the claim is denied, but why is it denying based on this LCD? This procedure code doesn't appear to be in the LCD. This procedure code isn't in the coding and billing article, so how can it deny for that? Those are the types of questions you have. Someone also asked about the different tiers within customer service. In general, our phone tier is a tier 1 and our written tier is a tier 3. Tier 1 is the most basic incoming. They would tier up to a tier 2 if it's too complex for them. And tier 3 is the highest level. They could take a phone call. However, it would be tiered to them through the process. They will also be the ones that answer your written inquiries. I'm pretty sure I got what you needed out of that, but if not, please let me know. Should I follow an NCD or an LCD when they contain contradictory information? So first of all, if they do contain contradictory information, always follow the national coverage determination. It is a national determination as written by CMS. If you are trying to look at a LCA or a coverage article related to an NCD, that's a coding and billing article. If you feel like that contains contradictory information, contact customer service and have them take a look at it, but you still want to follow that. Will we receive a list of who to contact when? That is going to be the PowerPoint. It's something that we can consider developing more if there is more of a need. Asking the right question from the start. This is a great comment and something that I just wanted to address. First, know what you need. Do you need a claim denial explanation? Do you need to know how this relates to this? How this denial relates to this NCD or this LCD? How this denial relates to this article? Know what you need to ask for first. If you're completely unsure and you're like, hey, I see a claim denial, but doesn't make sense at all, like nothing should be denying for this, that's also a type of question you can say, I understand it's denied. Why is it denied? There is nothing that denied for. There's no reason for this. Those are different types of questions. Are supervisors available to assist directly with more complicated problems when they are not resolved? That is the tier process used in customer service that I just described. So if you call in, you can go to a tier 2 or a tier 3. The supervisors don't necessarily handle those types of problems. That's not how CMS has designed the customer service program. How can understanding exactly whom to contact for policy clarification or denial explanations change the way our team approaches Medicare issues and reduces unnecessary delays in patient care? First, if you understand that you're getting a claim denial and you contact policy, they're going to simply refer it back. That's not a question for them. So if you don't know what's going on, that's one thing. If you call and say, hey, there's literature and it shows this, and the customer service rep's like, okay, they take the information down, but it doesn't really ever go anywhere. That's because you should have contacted for a reconsideration based on the new literature, which shows something different. That's how it can definitely affect patient care. Again, general claim denial explanations was asked for. And again, anytime it's a claim denial and WPS has processed it, start with our customer service area. Start with our customer service area if you have a denial question. Once it gets further in or they need to move it around, they can do the tier process, and that's what's going to happen there. All right, as I said, I don't think I was going to get to any of the other questions, so I apologize for that, but let me just quickly finish up for the day. So there is a customer service process change, and I want you to be aware of it as we've talked a lot about this type of information. Oops, I just saw a typo on my slide. It should say 1 MPI and PTAN combination. What that means is if you call in and you have an MPI, you will only be allowed to give us 1 PTAN per call. This is a customer service change. It's effective August 4th, so coming forward just a little while here. Why are we doing it? We're trying to improve call efficiencies, decrease your wait times, and quicker resolutions for inquiries. When we start moving through PTANs, so you have 1 MPI with multiple PTANs, maybe it's a group who has an MPI and then a bunch of PTANs underneath, that actually delays other calls and things happening. So we're trying to make it more efficient in that manner. We will email you a certificate of achievement as long as you gave us your email address. So if you called in, we'll talk about that in just a few moments. Within that certificate of achievement, it will have contact hours. Contact hours are given by governing bodies to decide CEUs, not by us. You give them the contact hours. They tell you if you get CEUs or not. Okay. Also, inside that email, you'll see your opinion matters and provide feedback. It's a link to the survey, but we're going to give that to you in just a little while here too. I know I didn't get through all the questions today, and I apologize for that. Some of them will be in the next session. But if you do have questions for the next 7 days, I'll take those via the email that we've gotten out a few different times. And you want to make sure that you do put policy context in the subject line. It's important to make sure that comes in so it gets forwarded to me, as we did have 5 different sessions today, or have had 4, and then we will have 1 more yet. So there will be 5 sessions. But you have 7 days to send those in, so follow that rule if you would like. All right, I'm going to have Jennifer paste in a link to the survey. That survey is the same one that you're going to get in that email box. The thing that we're looking for is on this session, not the MAE overall, but on this session, what you want to make sure that you're aware of. This session, what I do well, what did I do, what could I improve on, what would help you, would the PowerPoint have been better if I did, and you can insert whatever kind of comments you want there. You will be asked one single question about WPS overall, and we do take those seriously. This survey comments, we look at them on every single thing that we do, and we do that on purpose. The survey comments actually lead to changes. Let me give you a couple examples of that. First, we have added chapters to our YouTube channel based on your survey comments. We have training indicators based on your survey comments. But also, this session is from those survey comments. So I wanted you to be well aware of what happens with those. A couple of things. You're going to see a little box that looks like this. It's external. It's going to have a little triangle. When it comes up when we close the session, that's just taking the survey. The other one on top is what it looks like in our encore presentation for the survey. You can use those if you would like. Again, use the link that Jennifer put in. That's it, y'all. Thanks for attending. Thanks for listening. We hope to see you in just a few minutes at that question and answer session so you can get the remainder of your question answered. If not, please drop us an email and we'll get those answered back to you. Thanks, everybody. Have a great day.